In 1933, Dr. Cornelia de Lange, a Dutch pediatrician, described two children under her care with similar medical problems and a remarkable resemblance to one another. Dr. de Lange is generally credited with describing the collection of symptoms that comprises the syndrome bearing her name, Cornelia de Lange syndrome, or CDLS.
Children living with this diagnosis need accurate information. Their parents and their family members need support. It's a tough diagnosis. Living alone only makes it tougher.
CDLS is a congenital syndrome, meaning that it is present from birth.
It was totally unexpected. Totally unexpected.
They were concerned because he didn't look like a typical child.
The doctor that actually diagnosed him wasn't real familiar with it. He had only seen it once.
As with other syndromes, individuals with CDLS strongly resemble one another. Many characteristics can be present at birth, but not every child has each characteristic. Most children are born small and grow slowly, rarely reaching the size of their peers. Typical facial features include eyebrows that meet, long eyelashes, low-set ears, a short upturned nose, and thin downturned lips. Many children with CDLS face similar challenges: feeding difficulties, developmental delays, limb differences, behavioral issues, and the absence or delay of speech. All children with CDLS should be evaluated for life-threatening conditions such as heart defects, gastroesophageal reflux, and bowel abnormalities.
People with CDLS tend to be small. They tend to have more hair on their bodies and thicker head of hair than other people. They tend to have certain facial characteristics, an eyebrow that arches in a particular way and tends to meet in the middle, and very long curly eyelashes. And they have often differences in how their hands are formed, and very small hands and feet, and they often can't fully extend their elbow. From the developmental point of view, it can range from really having very little mental development and progression all the way up to nearly normal intelligence. Many pediatricians have encountered the condition in their training but wouldn't know how to diagnose it.
It can happen to anyone in any country, from any background, any race, any religion, any financial income level.
I mean, everything was perfectly normal through the pregnancy. There wasn't any sign of anything.
I had a typical healthy pregnancy. I mean, my first child, everything was perfect.
Do you want to go on a swing?
Until recently, the cause of CDLS was unknown. However, in 2004, a research team led by Dr. Ian Krantz at the Children's Hospital of Philadelphia reported that they had identified a gene that causes CDLS.
The people in my lab had been working really around the clock looking at this, and we realized that the type of change they were seeing could only have resulted in this protein not functioning, and we knew at that moment that we had found what we had looked for.
It was a very exciting day when Ian called and said that they had actually found a change.
I think it's helpful in that there are many families, sadly, even though we knew it to be a random mutation and told them that there was nothing that they did to cause it or that they could have done to prevent it. This just really validates that.
Just because you're different doesn't mean you don't play a very valuable role in this world.
The Cornelia de Lange Syndrome Foundation serves thousands of individuals with CDLS and their families. Family service coordinators provide families and caretakers one-on-one support. The foundation offers materials for public education and works to increase awareness of the syndrome. Together with a large network of doctors, therapists, and educators, the foundation seeks to improve treatment for those who have
Considered in
CDLS.
educational planning include the child's medical and health status, stamina, ability to manage sensory motor demands, levels of arousal, communicative status, need for structure and organization, relevant goals and objectives, motivation and understandable activities, and appropriate adaptations. In the medical health-related issues, teachers need to be aware of flare-up or gastroesophageal reflux, food allergies, and dietary limitations. In communications, students may have delayed or absent speech, difficulty in understanding the subtle nuances and pragmatic of language and auditory sensitivity to a barrage of speech sounds, oral motor apraxia. In a vision, students may drop for lubricating their eyes and eye washes done in school. They also may need preferential seating close to the blackboard, assigned seating facing away from the windows or other sources of glare due to their light-sensitive, adapted but non-glare lighting to highlight the specific work area. For the hearing, students may have hearing loss or fracture in hearing. Therefore, such students may require use of hearing aids, FM system, or preferential seating near the teacher. In the behavior, although many children with Cornelia de Lange syndrome have no significant behavioral problems, there are some conditions which makes self-injurious behavior more likely to occur, like pain, discomfort, frustration, or dismay. Thank you for watching my presentation.